Hello, ladies and gentlemen. Welcome to the Progressive American. I'm your host, Connor Kelly. Today, I'm sitting here with Ronald Gruner. He had a 40-year career as the founder and CEO of three tech companies, and in 2022, he published We the Presidents: How American Presidents Shaped the Last Century. Today, we're going over his new book, COVID Wars: America's Struggle over Public Health and Personal Freedom. Thank you very much for joining me, Mr. Gruner.
Colin, thank you for the invitation, and I'm looking forward to the conversation.
Absolutely. And this is an especially pertinent topic just because it's been so influential not only on the lives and health and safety of the American people over the last several years, but also in how it shaped our political environment. And I was wondering, just to get to the basics, what were some of the considerations that went into your initial creation of this book, what you wanted to get out of it, and really how it's been received thus far?
Well, those are excellent questions. First of all, I have to say, uh, it took me a while to decide to write this book because, like many Americans, probably most Americans, after the COVID pandemic, I was ready to move on, and I wanted to focus on other things. I had written "We the Presidents" three years ago, and I was looking for the next project. But friends and other associates suggest, hopefully, an objective, kind of engineering approach to COVID would be a useful contribution because there's been many books written about COVID, but in my introduction, I described them as largely being accusatory and angry. And so I tried to write a book, hopefully that was objective and ideally thoughtful. And I came at it from the perspective from two perspectives. One is a business person where, really dealing with facts and objectivity is important to survive. And secondly, complementing that as an engineer, I consider myself an engineer more than any other thing. And one of the mantras we have in engineering is data drives out speculation. So whenever I discussed a topic, I tried my best to back it up with verifiable data. And that's kind of where I came from.
And that kind of leads into the first part I wanted to get into, which is the reliability of data and the trust that has to be imprinted in that. Because a lot of times when we talk about COVID, there's an unfortunate reality of conspiracy theories, back and forth partisanship, and an unwillingness to engage with just the core facts on the ground as they happened, and then also looking back with information that we previously didn't have at the time. But when you were going through a lot of this data, what were some of the considerations that went into making sure that that information was not only available to you, but also presented in a way that didn't necessarily provoke some of those complications and really helped people to understand the severity of what happened?
Well, as you know, many people questioned COVID as an actual pandemic. They questioned the statistics they heard, and there's a lot of skepticism. So what I tried to do was, when I look for data, look for verifiable data that even the reader could verify if they chose to. So I'll give you a good example. Most of the data is based on the CDC, Centers for Disease Control and Prevention data, and a lot of people are skeptical of that. That's federal data, and it's a big government, and so they question that. But I point out in my book, but that data comes from the state, and the state gets it from the over 3,000 county health bureaus around the country. And those county health bureaus are very open. And I tested that myself I tested about a dozen. And what I did was I looked at CDC data for a particular county. For example, I live in Collier County in Florida, and that's obviously the first one I looked at. And I looked at what is CDC saying about death rates, for example, in February of 2020 in Collier County, and looked at what the CDC said. And then I went back to Collier County, which has a health site, and looked at what they said, and that data was essentially identical. And I did that for 12 other counties, about a third in Florida, about 10 or 15% in Texas, Massachusetts, and other areas. And in every case, I found that data to be reliable. The other thing I did was for every state and for 20 countries, I put together about 20 key statistics, everything from traditional health levels of obesity, education level, income, and then how they responded to COVID in terms of vaccination and death rates. And that's all part of the appendices with detailed data the reader, if they choose to, can research, because I knew people would be skeptical. And that's the approach I took.
Yeah, and just to give a bit of background of how I experienced COVID, I was a senior in college at the time, writing as an opinion journalist for the paper at the time that I'm pretty sure is now defunct, the Lorien. And one of the things that I found really frustrating was not only were we dealing with data constantly changing, but because people felt like they weren't in control, and many people didn't know where to look. So it's a nice thing to be able to see. Not only is there a level of transparency with how you approach this, and I was very impressed by that, because a lot of the conversation has been very accusatory and partisan, but also conspiratorial. But it also just lacked a lot of transparency about how people approached it. But the other side of this, and this is where I kind of wanted to get into the trauma side of things. I know I've mentioned conspiracy theories and things like that, and I think it kind of plays into this looking back, this hostility to looking back, or an unwillingness to look at the severity of what happened, and really not considering that this kind of thing could happen again. A lot of people don't want to engage with the topic, and you made that point earlier. How do we take works like yours and really the overarching history surrounding COVID, and get people to realize, hey, this is not only a concern from our past, but could be a concern in our future?
Well, I think, to be frank with you, I think it may take a bit more time than we've had already. We've had 5 years since the beginning of the pandemic, and having spent almost 3 years to date on this project, like you point out, there's a tremendous amount of emotion still associated with COVID and anger, and it's going to take some time for all that to wash away. And I acknowledge that in my introduction, saying I'm writing this book, COVID Wars, as much for my children and grandchildren as anybody, because I think a lot of people today have formed their opinions. It's going to be difficult to change that. But we have to learn from this, because we lost, to date, we've lost in the United States alone 1.2 million people to COVID. And hundreds of thousands more to COVID-related illnesses, and we're just beginning to grapple with long COVID. So we do have to learn from this, but I have to be frank, I think it's going to take a little bit more time than we'd like for people to really absorb it and look at it
Yeah,
objectively.
and I think the other side of this is this feeling of a lack of control. I know I mentioned it earlier in the question earlier, but I think the thing that struck me was, we as human beings, we as a society like to think we are the authors of our own story. And when something comes along, like a disease or something completely out of our control, it sometimes feels like sometimes feels like that people just reject that it is real, or they downplay the severity of it in order to feel more in control of how they respond to these kinds of disasters. But the other side of this, and I think it was something that's concerned me both in my career in political science and also just in activism in general, is apathy. So for context, when I was in college with that same paper, I wrote a piece called Price of Apathy, where I basically warned, using the 1918 pandemic as an example, that we have been here before. There have been diseases like this before, and without proper precautions, uh, people will die. And I was wondering, when you were approaching this subject, what consideration did you put into apathy, the way in which politicians were seemingly apathetic or dismissive, or the public was apathetic to the rising concern of COVID?
Well, I think if if you talk to people in 2019, December of 2019, before COVID came on the horizon, and if you asked people, for example, about the 1918 Spanish flu, I doubt if 3 out of 10 could really tell you what that was all about, because that was 100 years ago. And so I think part of the apathy we had about a pandemic that could kill 1 million people was we had never experienced it in living memory, and most people had never read about it or understood it. And so that led to that apathy. But the best example I can give that's more current goes back to George W. Bush, who in the summer of 2005 read a book written by John Barry called The Forgotten Influenza Pandemic, or something very close to that as the title. And that was a book about the 1918 Spanish flu. And that made a profound impression on President Bush, because he had just gone through a few years before the September 11 terrorist attacks, in which 3,000 Americans were killed. But he realized, reading John Barry's book, that over 1 million people could easily die in the pandemic. So he basically was able to persuade Congress to allocate $6 billion for supplies for a future pandemic. That would be masks, personal protection equipment, vaccines, the works. But we used all that up treating other illnesses such as SARS and MER and Ebola virus in Africa. And by 2014, 2015, the shelf was empty. And when Obama went to Congress to get more money, Congress, to use your term, was apathetic. They said, well, we've heard about pandemics for years. They've never happened. We've got higher priorities, and they did not allocate additional funds. So when 2020 happened, we did not have the supplies we needed. And that's probably the best case of apathy I can discuss or mention in the last 20
And the
years.
thing that disturbs me, because I was gonna bring that up earlier, but I think, like, the thing that disturbs me when I was reading through that section and hearing about that is there is an example, and you brought it up earlier, of the government effectively responding to disease, to deadly diseases that could be devastating, for example, Ebola. It's really, really frustrating to me because even though Ebola wasn't, like, it didn't spread in the same way that COVID did or other, similar coronaviruses, it does kinda show that when the Obama administration responded, they did so with a preventative approach. They were proactive. And I'm wondering what role did the lack of a proactive approach, play in not only preventing us from being able to respond, but reinforcing this idea that the disease was not that big of a deal?
Well, everybody took Ebola seriously. It was way off in Africa. Only two people in the United States died of that, fortunately. And we, the United States and the World Health Organization, did a good job of tamping it down in Africa. But what happened in the COVID pandemic, starting in January and February of 2020, uh, cable news, for example, social media said it's a political hoax. This is a hoax to undermine President Trump. He had just been impeached the second time. He was, of course, not convicted. Uh, Other people said, no, it's not that serious. It's not as bad as the flu. So there's all this misinformation floating around, particularly in cable news and frankly, Fox News, about the COVID not being that serious. And that set the stage for many, many people. And they stuck to those beliefs for basically the length of the pandemic. And then, of course, we had the same thing happen when vaccines came out. And that led to what you call apathy because people didn't think it was
And
serious.
I will also note, like, as much as I would love to go into constantly pointing out the Trump administration's responses to the pandemic being, problematic, and I will get into that, I do think it's also worth noting that a lot of Americans, generally speaking, had never experienced something like this, like you noted, and for all intents and purposes, these kinds of diseases are kinda seen as a historical footnote, something that cannot possibly happen to us, and I think that was one of the biggest impediments, at least in my small town experience in Dubuque, where people were actively saying, "Oh, we'll be back in a week," or "Oh, we'll be back. This isn't that big of a deal. It's just the flu." And really, the comparison to the flu, I think, was a really damaging thing because people downplay the severity of the flu. But what role did those kinds of comparisons play in not only reinforcing like fear or a lack of concern, but also the suspicion of government reaction to the disease?
Well, it just completely undermined, in many respects, it undermined the government. The comments you made and the information that was flowing out of social media and cable news undermined the government. And of course, the government did that themselves. I mean, President Trump, the World Health Organization declared a worldwide pandemic, COVID pandemic, on March 11, 2020. And 2 days later, on March 13th, President Trump declared a national emergency, COVID emergency. And that was good. And he said, we highly recommend, we urge you to remain at home, social distance, only go out when you need to, and for the next few weeks. And that was because the hospitals were filling up. But then less than a month later, he was sending out tweets saying, liberate Michigan, liberate Minnesota, because he had his base, frankly, protesting, staying at home in the lockdowns and businesses. I mean, I understand why they were anxious about that, but he wasn't consistent, unfortunately. But I give you an example of myself. I mean, during the pandemic, I mean, I had a lot of people that weren't taking it seriously, and I had a number of Facebook postings, which I have on my website now. Which one was the end of March, and I talked about this could be serious, and I showed how we had already had 1,000 deaths, and it could increase significantly. I had no idea in April, 70,000 people would die. So in April alone, we went from 1,000 people. It was doubling every 3 or 4 days. And by the end of April, 70,000 Americans had died of COVID, which was just unbelievable at the time. So it caught us by surprise how quickly it happened. And then by the midsummer, it was, I forget the precise numbers, there was 150,000, 200,000 people. It just happened so quickly, people could not get their arms around it. And by the time it got to the point where the COVID deaths were undeniable, a lot of these opinions and beliefs had been solidified and people didn't want to move away from
And
them.
I also think, like, for me, when I was writing about it initially, like, as a student, I really had a lot of trouble trying to explain the scope of what was happening because the data that I submitted and the information I submitted was outdated. Like the day after I had submitted my essay about the death count, it was completely outdated because it had risen to such an extent. And I think that's the thing that really terrified me when I was looking at this is it wasn't just the historical context of the 1918 pandemic. It wasn't just that there was this an unwillingness to consider that this might be a life-threatening catastrophe for the American people and the world over, but there was just the speed and scale of what was happening and being unable to communicate that. And I think the 1918 pandemic is a perfect example of that because there were anti-mask leagues as well. What were some of the lessons from the 1918 pandemic that you personally think we missed or downright ignored?
Well, the pandemic, the 1918 pandemic, in many respects, was similar. It came upon the country very, very quickly. It was a handful of cases in the spring of 1918 in Kansas, and by September, tens of thousands of people were dying a week in the United States. So that came upon the country very quickly. But the country, like the United States, divided very quickly also by politics and just by how they perceive the pandemic. And I'll give you two brief examples. In September, the United States government was promoting Liberty Bond parades and drives to sell bonds to pay for the war debt. And so cities had to decide what they wanted to do. This was in the beginning of the pandemic, the Spanish flu pandemic, September. So Philadelphia chose to have a parade. They had a major parade. 200,000 people participated in mid-September. But just down 200 miles, 300 miles to the west, St. Louis chose not to. The public health people said, we think it's too dangerous. We should not do it. We're not going to hold it. And the differences in death rates in the first half between September and December of St. Louis and Philadelphia were profound. As I recall the numbers, in those 4 months, Philadelphia had 14,000 flu deaths, 14,000 in that city alone. St. Louis had 3,000. And that was a very clear example of the difference in public health policies and how that affected death rates. And we had large differences during the COVID pandemic. They weren't that large because we had better medicine for treating the cases, even the ones that got very serious without vaccines, but it still was quite large. One other quick example is, of course, people in the United States during the pandemic were hesitant to use masks, social distancing somewhere. Obviously, closing schools and businesses had a catastrophic effect in many respects. But the same thing happened in the Spanish flu. As a matter of fact, although in some cities were mandated to wear masks, men would wear masks, but they would poke a hole in the mask so they could smoke a cigar as a way of protesting. And so you had many of the same things even back in 1918.
And I remember reading about some of these things because I was lucky enough to be sort of mentored by Dr. Anderson Bricker at Loras College about much of this in the Center for Dubuque History. So that was kind of a little bit of background. I wasn't particularly focused on immunology or anything like that. So I'm not an expert. If anybody who watches this after the interview tries to argue otherwise, I'm not portraying myself in any way, shape, or form as an expert. I'm more an interviewer. But the other side of this, and this is where I get frustrated both as a student of political science and somebody who focuses on history as well, is when we talk about the 1918 pandemic, people think of it as something in the past, something that's far away from us. But relatively speaking, 100 years is yesterday. And I think one of the things that I've tried to emphasize in talking about these comparisons is emphasizing the recency of it. And I was wondering, have you had any issues with people trying to downplay your examples of the 1918 pandemic? Have you had to go back and forth with people on this issue, or have been people mostly receptive?
Well, I think of the 1918 pandemic because all the emotions washed away. Yeah, I think people don't question that it happened. It was real. It killed as many people as died. So I think people look at that fairly objectively as opposed to the current pandemic. But I write about in my book the London Plague of 1665. I mean, that was much longer ago. But they went through some of the same things we went through with the COVID pandemic and the 1918 Spanish flu. Much of the population in London questioned how serious the disease was, continued their business, continued going out, and many of those people died. So there was skepticism. about the plague in London even back then.
And I also think the other side of this is the element of social media. I mean, we're using social media right now on a show called The Progressive American. So it's not like I am immune to some of the influences that we're talking about here. But I do think there's another side of this, and that is the role of social media actors who actively have a financial benefit by downplaying or reinforcing the fears that people have about government control. And to be clear, people should be skeptical of their government when they have reason to be. But I think one of the things that startles me is people seem adversely, firmly opposed to the idea of any sort of precautions to prevent this from happening again. And with all this social media propaganda, with this denialism, I'm gravely worried that if something like this happens again, we will just downplay it or ignore it. And I'm wondering, what can we do to prevent that? Can we pull people out of that conspiratorial thinking? And more importantly, what steps can we take to make sure that we don't lose as many Americans to another disease like we lost with COVID?
Well, somehow we have to get the economic side of the situation. In social media, there's thousands and thousands of people on social media, and everything from blogs to podcasts to Substack, etc. And I have a Substack, and I have to say, I watch my let's call it my ratings and my participation right now. My Substack is free, and as I tell my subscribers, they always will be. But but people that are on social media that need to make a living on social media and that have millions of viewers, they're very, very conscious of how their audience is reacting. And it's only natural, unfortunately, that they adjust their message to attract and motivate their audience. And the economics are on the wrong way in that. And that's why back 60 years ago, the three major networks, back when we only had three major networks, ABC, CBS, and NBC, they had their news as a separate division. That was a money-losing division. And the whole purpose of those divisions was to serve the public interest and provide, ideally, factual and objective news. Now, they were sometimes accused of being slightly liberal, for example, or slightly biased, but for the most part, they did their best to be objective in the delivery of news. But social media and cable news, it's all ratings-based. And so they're doing everything they can to keep those ratings up and build their audience size. And we saw with the lawsuit and the settlement against Fox News on the January 6th conspiracy theories that they paid out almost $800 million for spreading disinformation about that election and telling their viewers what their viewers wanted to know as opposed to what the facts were. And that cost them $800 million already, and there's more lawsuits coming. So it's a huge temptation to tell the audience what they want to hear, particularly if the audience is paying to hear what you're saying.
And that's something that's really frustrating me because, like, obviously I've kind of joked a bit about, the name of the show and the kind of perspective I take here. I don't deny that I'm a progressive. But the thing is, all commentary channels, at least ones that hopefully focus on honesty and accuracy, depend upon good news, good information, and accurate data. And what's I've been writing about and raising concern about is the destruction of local media, the destruction of standard news that does like hard hitting journalism that actually informs the people with the things they don't want to hear. And I'm wondering, when you were going through some of your research, did you at all look at like how the destruction of local media or the attempt to invalidate mainstream news contributed to conspiracy theories around COVID, or was that something that was a little distinct?
Well, Connor, I have to disagree with you a little bit in that I don't think to be successful in social media, you have to give out accurate information. I mean, let's talk about Alex Jones and InfoWars. For years, he spread disinformation about the Sandy Hook murder massacre in Connecticut. And he built a large audience believing that. And I don't know whether he believed it or not himself. I can't imagine he'd believe that. He's an intelligent person, but that was a message he wanted to convey to his audience, and millions of people believed it, and he said it for years. Now he's got $1 billion lawsuit judgment against him because of that. But I think there's a lot of people that could give a hoot about what's accurate and what's true. They just want to say what motivates the audience.
To clarify here, and I worded that improperly. When I say depend, I mean the quality of the podcast, the quality of the information provides depends upon good information from the media. Because like if you have just all propaganda, all partisanship, that goes away. But that's my fault for raising the question a little differently. But to get back to
Okay.
the destruction of media, people like Alex Jones, people like Candace Owens, people like RFK Jr., they really depend upon being able to lie, just like you said. And I think what I've been really, really worried about is with the invalidation of media, the news, mainstream newspapers, and news channels, it seems like there's more and more of a way for people to say, hey, they're only calling me out because I'm telling the truth. Get all your truth from me. Has that been a problem on your side of things when you're trying to warn people about like not only what COVID was like, but also how it impacts us going forward?
No, I can't say it has been an issue because, first of all, I've only announced the book on March 11th, so it's been a little bit more than a month. So I'm just getting into the whole aspect of that. But I try to present myself as an engineer and as a business person with backed up by data. And whenever that issue comes up, for example, if people question, well, I don't believe that many people died of COVID in Ohio, for example. And I say, well, here's the data. And you live in what county in Ohio? And they tell me, and I say, well, look it up on your public health bureau and see what they say. Now, if there's a conspiracy with 3,000 public health bureaus, I probably can't help you. But if you're willing to believe that, you know, your local health bureau, you can walk down and see them in person. If they tell you that's the facts, then I think
Yeah,
you're correct.
and that's where it fundamentally for me is some people are just so beholden to this idea that everything has to be a conspiracy that it becomes almost impossible to get some of those people. But to move back into some of the subjects and the origins of COVID, I wanted to get into specifically the origin of the pandemic with Wuhan and how a lot of the discussion surrounding Wuhan, particularly some of the conspiracy theories around Dr. Fauci, and really just the claims of biological weapons attacks and things like that have really made it hard to actively talk about prevention. Could you go into some of the concerns that you raised during the book and how that's been really played out on social media and in the news in general?
Well, that was an issue from the very, very beginning, starting in January 2020. And I would say in February, I'm trying to recall from the book now, roughly in February, Fox News quite innocently had a feature about Kuntz, who wrote a book about the development of a laboratory-based coronavirus. This was back in like 1981. And the idea was that this coronavirus, and that wasn't a coronavirus, this virus had been developed at a laboratory in China by coincidence. This is in his novel, Kuntz's novel, was in Wuhan, China. And it escaped out of the lab and escaped to the world and killed millions of people. And they had a feature on that, which was just saying in a kind of an interesting anecdote. And they said they presented it very honestly and in a kind of an amusing way. That kind of got caught on, and that's kind of the beginning of the lab theory. And then that spread, that initial idea spread into, well, maybe it did happen. And it went on and on. Now, what I will say, one of the most common questions I'm asked is, do you know, or where do you think the virus came from? And I have to say, I don't know, and I'm not sure anybody does know. Now, Congress has had nearly 4 years of congressional investigations, one run by the Democrats, one run by the Republicans, deep, intensive investigations. And neither one were able to come to a conclusion of where it came from. The Republicans looked very, very hard for that, and they were the second investigation to be conducted. And in their what was a 195-page report, they simply said, "We don't know, but we know it wasn't a conspiracy theory; it's a possibility." Now, the way I looked at it, the way I presented that in the book, Connor, is I looked at it kind of as an engineer. We had a number of intelligence agencies said it's possible, perhaps even likely, it came from a laboratory, and almost an equal number saying we're not sure it did. It looks like it was not human developed. So what I looked at was statistically. I just go on just for a
You're
second.
good.
In China, there are 39,000 what we call wet labs. These are labs that sell fresh meat, even live animals that are slaughtered in front of the customer so the customer knows it's fresh meat. And these are obscure kinds of meats from Western standards, snakes, civet cats, and things like that. About 39,000 in China. In Wuhan, China, the largest and most secure virus research lab was in Wuhan, China. And so the two theories about where that virus came from, was it leaked out of the lab, or it was somehow found in the wet market because an animal there had the coronavirus and it started there. But if you look at the probability of the virus coming out of this lab in the same city 7 miles away, coming out of a wet market rather, 7 miles away from the wet lab, from the laboratory, which was doing research, it seems almost impossible. 39,000 and only one, which happened to be next to the laboratory, is where it came from in the wet lab. That seems improbable, but I don't know. I will point out one other thing. It took on the SARS virus going back to 2005, early before that, it took us 15 years to find where the virus actually came from. That was from bats in a cave deep in China. So we may well find where this virus came from, but it may not be in the next few years. It may take
And
a
that's
while.
where I kind of want to wrap it up a little bit, but because it's really important for people to say, I don't know. I have been kind of harping on this a lot in both in my public and private life, that a lot of times when people have a question, especially in a politically charged atmosphere, they just want to have an answer. They don't really care whether or not it's accurate or not. So first of all, I'd like to thank you for saying, I don't know for certain. Here are my thoughts on that, because it really is,
Yeah.
it really does need to be said more often, because I personally don't know. I've never been there. I don't have the resources to confirm it. But
That's a good point because so many people have such strong opinions. And so being able to say, I don't know, I
yeah,
think is very healthy.
and I
I
will just
agree
say,
with you.
for anybody who's listening, regardless of where you stand on the issue of where the virus originated, I think it's important to take a step back and admit that there's probably a lot of information that we are still trying to find, not because there's a conspiracy theory, but because gathering information is a form of labor. It takes time and energy. And Mr. Gruner here has spent a lot of time focusing on that very labor. But to wrap up, I just want to ask, when it comes to how we will look on your work and other work surrounding COVID in the future, what do you hope future historians use your work for? How do you hope they will perceive it? And more importantly, how do you think this will help other people prepare for the next pandemic?
Well, ideally, 100 years from now, this is very egocentric and presumptuous and pretentious. Okay. But ideally, 100 years from now, my book, and perhaps others, hopefully others, will be picked up by historians and medical research and look at that and say, this is a good overview of what happened to those poor people in 2020 through 2023. It really discusses the aspects about how the economy was affected, how society was affected, how school kids were affected, COVID death rates, and then all the things surrounding that, like the conspiracy theories we just talked about. And so maybe they can, hopefully they can learn from that and see what we went through and help avoid going through similar things when it will happen again and pandemics will happen. So that was why I wrote the book. I didn't really, and it's kind of crazy. I didn't necessarily write it for this generation. I say that in the introduction. I wrote it for future generations to learn from, because we really didn't learn from the Spanish flu. Very similar, but it wasn't in the national conscience. And perhaps this one will be.
Well,
We'll
one can
see.
only hope. The book is COVID Wars, available wherever you find your books, such as Amazon Thrift Books. And are there any other locations that I'm not aware of at this moment?
Well, it's available everywhere. Now, if you go to your local bookstore, whether that's an independent bookstore or a Barnes and Noble, if they don't have it in stock, they can order it anywhere and get it within a few days. So it's available everywhere, including all the online
Wonderful. Thank you
retailers.
very much, Mr. Gruner. And thank you, everybody, for listening, and have a wonderful day.
Thank you, Connor. Good conversation.